Good afternoon, and thank you for joining us today from NASA's Kennedy Space Center in Florida for a discussion of the Launch Health Forum that's taking place here at Kennedy. I'm Dave Steeds from NASA Headquarters Public Affairs. Joining me today to talk about Launch Health is Dr. Jeff Davis of NASA's Johnson Space Center. Jeff is the Director of Space Life Sciences at Johnson. Joining Jeff is Dave Ferguson. Dave is the Deputy Director of Science and Technology at the U.S. Agency for International Development. USAID is a partner with NASA and Nike for Launch Health. Also joining us is Mikhail Vestergaard-Franssen. Mikhail is with Vestergaard-Franssen of Lausanne, Switzerland. Following opening remarks, we'll take questions from here at Kennedy. Jeff?
Well, thank you very much. I'm very pleased to be here today to participate in Launch Health from NASA. Which is a collaborative forum to discuss issues of health in many challenging environments. We're very interested in innovative approaches to health and prevention and care. And since many issues can be common to many partners, we can leverage the experience of others in academia, industry, and government. We're always interested in innovations that may have applications both on Earth and in space. Give you an example, for instance, perhaps diagnostic devices that have low weight, low power needs, very little training needs. And from this morning's session, I've already seen two technologies that could easily have applications both on Earth and in spaceflight. Just a little bit about what we do in the Space Life Sciences Directorate. We've started back since 2007 with a strategic plan, really looking at forming alliances with others that have mutual interests to our space life sciences needs. And we have been trying new collaborative tools for some time, both business plan competitions where we offer an Earth Space Life Sciences Prize, open innovation challenges and platforms where we make awards for challenges, and we've issued some fairly difficult technical challenges, and also for collaborative research models. So we see Launch as a great collaborative forum for discussion, for exchanging ideas, and for looking for new technologies, and especially those that have applications on both Earth and space.
Thanks, Jeff. Dave?
Well, thank you very much. This is just such a great honor to be here with NASA and Mikhail and just the whole group around Launch Health. Launch Health really provides an incredible platform for USAID to address some of the most challenging issues in development by inspiring entrepreneurship and new thinking as to how we can go about attacking these problems. USAID is focused on supporting breakthroughs in science and technology to apply to the developing world and really help advance our efforts to meet these development challenges. The Launch Health platform and the system that we're supporting here really is made up of three parts. All right, we start with sourcing innovations and council members to come together for this two-day event where we mix the two and really spend our time looking at how can all of the various disciplines that have been brought to the table here be used to help advance these innovators and their innovations to impact it, certainly from our perspective in the developing world, but this also will, we think that there's potential in the developed world and in spaceflight. So we're really so encouraged by the number of innovators, the breadth of their innovations. Launch Health really plays to one of USAID's strengths. All right, we have a long history of leadership and engagement in global health issues. We're supporting the President's Global Health Initiative, all right, by tackling crucial global health challenges in scores of countries. And through Launch Health, we seek major breakthroughs that will enable us to meet our mission to help with health challenges around the world. The Launch program also helps us explore the boundaries of where we're going in terms of open and collaborative approaches to solving development problems. All right, this is a cornerstone of the future of the way USAID is going to execute in this space. All right, and we believe that these approaches will be the way that we will find the global health solutions that are going to have the impact that needs to be made in these developing countries. There are many more actors in the development space than there have ever been, and finding new solutions to development challenges really is going to come from the intersection of these actors and innovators and this group assembled here. So launch is a good demonstration of how we want to engage in an open approach. All right, and we used an open call using a platform to call for innovations from the public. That was a big part of how we got to the innovators that we have today. And finally, the launch program itself is an important partnership. It's a partnership among federal agencies. It's in a partnership with private sector companies. All right, and that approach of partnering and being able to leverage strengths across many parties to bring to the table the kind of solutions that we need in the developing world is a key part of how we intend to proceed. So thank you very much, Dave.
Thanks, Dave. Mikhail?
Well, thank you. I want to start by saying I'm really honored to be invited and to continue as a launch council member. It's hugely exciting work that we're doing. I run a company in the business of saving lives. It was a company that was founded by my grandfather on an $800 Marshall Aid loan. So we feel that we have a special relationship with the United States. Today we're exclusively focused on fiber technology that combats some of the biggest killer diseases on the planet. We're very involved in malaria prevention, scaling up to, together with our partners, cover close to 70% of all sleeping spaces in Africa today with bed nets. We're very involved in guinea worm eradication, which is a highly successful program today where we only have four countries left to eradicate the disease. We're taking on some of the greatest challenges that we can find out there in the space of infectious diseases. We've tailored our entire innovative platform to develop technological breakthroughs to the benefit of the most vulnerable people in often the most extreme situations. And it's the extreme situation that is our parallel with the work done here at NASA and why we can learn so much from the innovators and from NASA. And we're very excited to be part of this. I want to say that what really motivates me to be here is when looking at the single biggest measure of human welfare, it's average life expectancy. That's 40 years in the poorest countries and it's 80 years in the richest. That's for us an intolerable gap. And that's what we're hoping, together with the innovators, together with the technology reviews that we're making here, to come up with great solutions that can have a great impact. Thank you.
Thank you, Mikhail. We'll now take questions from here at Kennedy. If you have a question, please raise your hand and wait for the mic. We'll also ask that you state your name and affiliation if you have a question. Are there any questions?
I'm Mark Ratterman with Talking Space. I've got a question. I heard the terms collaboration and innovation, and I have to ask, will collaboration accelerate some of the innovation and acceptance and implementation of things that you're focusing on?
Jeff, would you like to try?
Sure. That's a great question. We really firmly believe that collaboration will accelerate the innovations that we see. I mentioned we'd done some background work in strategic planning and had also done a benchmark about alliances, and there was a 100% correlation of working with others through alliances and innovation. So we really have embraced that as a very effective way not only to identify new ideas but to accelerate their acceptance, especially when you can find utility both in many different spheres. So if you can find utility for use on Earth and in space, we think that's a very powerful combination.
Yeah, and I'd just like to add, from a USAID perspective, everything that we do is done in collaboration with our developing country partners and the beneficiaries that we seek to support. So there's no other methodology for making this go, right, than doing it in collaboration with both the governments, the civil society organizations, and the beneficiaries themselves.
Do we have any other questions? In the front row.
Hi, Ken Kramer for Spaceflight Magazine. I wonder if you could talk a little bit in detail about some of these health issues that you're working on collaboratively with NASA to address the health problems on Earth and in space. Okay, like what you have listed here, vaccines, these needles that dissolve and things like that. Thank you.
Sure, it's a great question. That's one of the ones that were presented this morning was the BioNeedle, for instance. The key underpinning technology, I think, one of the keys is the absence of need for refrigeration. And so that is a huge item for us in spaceflight, and that's also huge for distribution of vaccines. And so we're very interested in exploring those ideas where you can deliver medications both on Earth and in space, and especially if you can remove the need for refrigeration.
Yeah, I just want to add that from a public health perspective, there's a number of interesting propositions put on the table by the innovators today, and specifically looking at BioNeedle. That's an innovation that potentially does have a great chance of changing the face of a continent such as Africa. It contains some of the key elements, as was just mentioned, that are necessary for NASA. You're finding that as well in global public health. Ease of distribution, because no refrigeration is needed. High efficacy, where you reduce the wastage involved. Reduced cost along with that. Billions of dollars are pumped into vaccination today, and I think it has a great potential. So we're excited to potentially move that one forward to the acceleration.
Okay, thank you. Do we have other questions here?
Denise Chow from Space.com. I was just wondering what the process was for how the companies or innovators were selected to be a part of the forum.
Yeah, so that process was first, we sourced as many innovators as we could through two processes. Right, one, an open call on, we used Innocentive.com, and we posted a challenge there, and people were able to respond to that, and we brought those in and looked at them. We also did primary research, right, and secondary research to review, all right, what's out there, and we invited people to participate, and then we went through a vetting process of which ones of these do we think fit the goals that we've set out in the challenge statement, and how do we see them in terms of effectiveness. And then we went through a ranking process using primarily the founding partners, but also some of the council members in the process of a voting process to decide, these 10 will be the ones that will come to the event.
Okay, are there any other questions here? If not, for more information about launch.org, you can go on the web to launch.org. That's HTTP. Oh, I'm sorry. You have one more question?
Something we discussed earlier. Can you talk a little bit about the utility of these high-pixel cell phone devices, please? For taking an image of rashes or something, or other diseases or broken bones or something that a patient might have, and how that could have application in space and with the third world countries.
Sure. Again, I think it's a very similar process. You have a distributed diagnostic system. So you have a system that's based on an available technology, and if you can think of it as devices perhaps being clipped on, just as a a simple analogy. So you can use this platform, the phone, and perhaps generate, whether it's through photos or other cameras or other diagnostic devices, perhaps get a very distributed set of systems for diagnostic devices. And we could certainly use that in spaceflight as well.
And that's not available now. Is that right?
Well, there are some proposals, for instance, in this group of innovations, using the cell phone to do just that.
Well, what I mean, though, these high pixel devices, these are not on the ISS now. Is that right?
I don't believe we're using a high pixel device on the ISS right now. We do have some specialized cameras, but I don't believe they're working through the cell phones.
And in the developing world, the explosion of cell phones into the hands of, you know, over 5 billion people provides a platform of ability to both deliver information and also collect data about what's going on in these in places, and provide, you know, custom support for individuals is just unparalleled. The kinds of innovations that are going to go on to those platforms, that are going to be providing services, going to be providing information, going to enable us to understand, you know, where the problem is. All right, how can we attack this more effectively? Because we've got all of these data sources out there. The power of this platform, we are just beginning to scratch the surface. And when it comes to the device itself, you might say, well, in a developing country, though, I mean, how many of these high, you know, resolution, you know, handheld devices are there? Well, there doesn't have to be many, right, for them to be very productive in a shared environment. And then I would ask the question, well, how long do we think it will take before, you know, a very inexpensive handheld devices, every one of them have this kind of high-res screen? So our ability to think about how to utilize that for diagnostic information, for communicating information about, for farmer extension services, for farmers to be able to take pictures of their crops, say, help me, what is this thing, right, from either a plant disease or an insect. The possibilities are just endless, and our efforts to look at how do we leverage mobile platforms for development is a big part of the kind of things that we're doing in the Science and Technology Office at USAID.
And I guess because they're so small, you could easily deliver them in emergency situations or other situations. They don't have to be there. You could deliver them quickly, right?
That's true too. It's a, you know, it's a very the devices themselves are very mobile. Right. In addition to them being able to be connected, you know, virtually wherever you are in the earth.
So like in Pakistan, where there's been this very extensive flooding, I guess that might be a utility in situations like that.
Absolutely. Absolutely. And, you know, I think the range of applications, we are attacking it largely from the areas that are most, you know, that are most critical from our agency's mandate, around agriculture, around health, around education, around good governance. All right. But there are applications, you know, beyond that as well. But even, you know, we're just beginning to scratch the surface of what we can do, you know, within that scope. And, you know, we're continuing to use programs like Launch to explore, look, where's the possibility here, and for us to be able to grab new ideas, put them into action, and really work toward, look, we want the best ones to scale. All right? We need to be able to provide benefit to millions of people, hundreds of millions of people. And that's a real driver of the way we look at how do we solve these problems.
Okay. Are there any other questions? Hearing none, again, for more information about the Launch Health Forum and launch.org, you can go to the organization website at http://launch.org, O-R-G, Launch.org. And with that concludes our briefing. Thank you for coming.